Bismillahirrahmanirrahim. Honorable President Agha University, Dr. Sulaiman Shahabuddin, distinguished members of the Diplomatic Corps, faculty and staff members of the university, distinguished guests, Assalamu alaikum. I'm delighted to stand before you today at the inaugural AKU Health Tech Summit. I express my deepest gratitude to President AKU, Dr. Shahabuddin. I didn't do anything. Can I turn this on? I have to do the ritual of reading.
No issues.
I express my deepest gratitude to President AKU, Dr. Shahabuddin, for graciously hosting this visit to the Agha University, and to all of our distinguished presenters and participants for sharing their knowledge and perspective. Provision of universal access to quality essential health services is the constitutional responsibility of the government. While we strive to provide equitable health services to our citizens, we deeply appreciate the role of philanthropic as well as the private sector. We all know AKU as a leader in education, research, healthcare delivery, and now with its latest venture in the arts and sciences. Agha University has truly become a national asset for Pakistan. It is a matter of pride for us that various organizations have ranked AKU among the top universities in the world in various fields within the health sciences, based largely on its research. This reflects that Pakistan is performing at very highest levels of quality and knowledge creation internationally. At the same time, AKU has repeatedly demonstrated that it is no ivory tower institution. In the time of crisis, it has responded with courage and compassion to help those in need. During the pandemic, it not only cared for thousands of severely ill patients, it trained thousands of government doctors and nurses in caring for COVID patients and set up a hotline to assist intensive care physicians at other hospitals. During the floods, AKU established hundreds of health clinics in affected communities and provided basic health care to more than 400,000 people. Across the country and around the world, we see AKU graduates positively impacting society as ethical leaders and innovators. This characteristic of focusing on the ethical side of providing medical services is worth emulating by all of our medical education institutions. Indeed, AKU is now more than a national asset. It is one of the world's most international universities. It is in Afghanistan, Kenya, Tanzania, Uganda, and the UK. It is inspiring to see a Pakistani university carrying its success beyond our borders. AKU's impact is a testament to the vision and generosity of His Highness the Agha Khan. His Highness has always believed that the people of Pakistan deserves the very best in health and education. For over 40 years, he has been acting on the belief and inspiring countless other people to do so. It is a pleasure to be able to publicly thank His Highness for his leadership. As all of you know, the potential of technology to reshape healthcare for the better is immense. Gene therapies are no longer the stuff of science fiction. They are realities, including here on AKU's campus. Digital technology is a powerful tool for health care providers, whether you are talking about electronic health records, telehealth, or mobile apps like the one developed by AKU for lady health workers in Gilgit-Baltistan. The opportunity to use the data that digitization generates for research and care improvement is huge. Artificial intelligence has the potential to transform diagnostic and detect disease for earlier than is possible today. It is an exciting time for patients and providers, and it is an exciting time for government as well. We are eager and determined to take advantage of the opportunities that technology creates to enhance access to high-quality preventive and curative care for the population, including and especially the most vulnerable. I'm glad that all of you are leading the way in using technology to provide patient-centric care, from early diagnosis to treatment for some of the most complex health conditions. Pakistan needs your support as it works to make the most of health tech innovation. Through technology, our dream of providing health services to all our citizens shall be fulfilled, inshallah. I extend my heartfelt gratitude to the civil society, corporate sector, and donors and supporters who are partnering with AKU in creating best practices and setting the highest standards for innovation in healthcare. I express my gratitude to AKU for the invitation and the opportunity to be part of this Health Tech Summit. Together, let us forge a path towards a healthier, technologically empowered future for Pakistan. Well, prior to thanking you all, I'll just share some random thoughts also. First of all, thank you for inviting me here earlier to the interactive session with the students, and then now being here in this such an great intellectual ambience where I feel dwarf in the presence of so many accomplished individuals. I've always dreamed to be a teacher. I failed. I couldn't become a teacher. And then I had to do politics. Well, the two juxtapose, I'll leave it to your imagination that which one you term the best as a profession. The anticipated challenge, if one can peek into the future, is the creation of technology. There's no doubt about that. And this technology probably is not just have implications for our healthcare systems, but for our entire way of life. It is our ethics which would be impacted. It's our religion, it's our philosophy, it's our democracy, it's our entire way of looking at how do you perceive life. Now, my son who's 9 years old, he was almost 4. And I was probably reading something one day, he struck with me. He asked me about something. I just wanted to get rid of him. I said, well, I don't know. He goes to me in Pashto, Google na Pashto ka? He abruptly told me that, why don't you ask Google in Pashto? So it struck me that, yeah, well, there is a bigger role model in his mind, which is more than his father, that when his father fails, there is another bigger father figure by the name of Google, who can fill in those shoes and play that role. So what do you do with the Google? Google, if I ask something about an ethical issue, about a religious issue, about a political issue, Google can provide tons of information which is available. So this is dangerous. This is pretty much dangerous. How do we seek centuries and centuries of this process of knowledge creation has been linked with quality and authenticity? I mean, you can't just ask about any diagnosis if you're frightened or if you're not comfortable that it will give you the right kind of diagnosis. What if it gives you a wrong diagnosis and you suggest the prescriptions to that patient and he or she dies as a result? So there will be a small technological error, but there's a real-time consequence. So what do we do with these challenges? Any sort of wrong application of the technology is part of the challenge. How do you deal with the technology? So here comes the regulations, the role of the government, partnering with all the R&D based interventions, that on one hand you have to encourage that the research and development should go on, and under the name of regulation, they should not be stifled. And at the same level, that you want to balance it out, that it does not have kind of negative implications for the general social order. We are always interested to keep the social order, no matter what. That is the topmost priority, of any political figure or other leadership role people. They're very paranoid if we feel that social order is being threatened and there is a chance of chaos. We human beings don't like that. We hate it. We're quite abhorrent about it. But change, yes. Of course, change has to come. And change can never be resisted. The best thing about the change is that instead of containing it, engage with it. If there is an engagement with that, so the change becomes more of a pleasant happening rather than something which is nasty. So I'm glad that I'm here. I'm trying to pick from the suggestions which has been formally given to me or which would be sent to me later to my office. I stand committed here that I will take all these input quite seriously. We will deliberate over it. We have got specific offices to focus on this, and this idea of having an authority, which probably you suggested, it was the pick for yesterday's discussions. We'll take it on and we'll try to institutionalize that. And if we can get some sort of think tanks or council for the guidance of the technology, would be a brilliant idea. Let's have more conversation, be it from related to AI or any other technology. Sitaro se aage jahan aur abhi hai, abhi ishq ke imtihan aur abhi hai. He's a very famous Urdu poet and quite imaginative. He's referring to the exploration and discoveries of the universe, that there are worlds beyond the appearance of all these stars. So the love or the passion is demanding to explore the universe further. So there's an ongoing activity of creativity and exploring it. So this AI is not an end in itself. It's just probably a beginning. We don't know if somebody could peek into future, that what lies there. No one can imagine somebody residing in 18th century or 17th century would have been unfathomable for him or her to think of anything slightly closer to a tool of AI. But it's here, just around the corner. We have it, So down the line, after 1,000 years, in next millennia, in the same kind of an auditorium, someone would click it and recreate what we were talking over here. Maybe, we don't know. And they would refer to this conversation that, look, someone about 1,000 years back did anticipate some kind of this sort of creativity. So we don't know, It's all human imagination, which has a capacity indefinite. It has no limit. It's limitless. So let's benefit from the nature's endowment, from what it has bestowed on us as a Homo sapiens, and take the best out of it. Thank you so much. Humble to be here.